Hi there, welcome to the Happy Healthy Moms podcast, and thank you for joining me. My name is Kim Sullivan. I'm a 34-year-old full-time mom of three and a part-time student working on a nursing degree and currently studying public health. I'm here to talk to you about a topic near and dear to my heart, which is peripartum depression. All right, so I'm sure the majority of you have heard of postpartum depression, but you're probably wondering, Kim, what the heck is peripartum depression? Well, I'll tell you, they really aren't so different. Peripartum depression is depression experienced during and or after, and sometimes because of pregnancy or childbirth. So postpartum depression is actually included under that umbrella of peripartum depression. Those at risk are pregnant women and women who have given birth within the past 12 months. A little trigger warning here on additional risk factors, which include miscarriage, premature birth, having a baby in the NICU, an unplanned or unwanted pregnancy, lack of support from family or your spouse or partner, being a young mother, being a single mother, being a victim of domestic violence, or experiencing financial hardship. The symptoms can be severe or mild and include mood swings, increased or decreased appetite, low energy or exhaustion, crying, social withdrawal, feelings of hopelessness, and difficulty bonding with your baby. Now some of you, especially if you've had kids, are probably saying, well, hang on a minute, isn't everyone tired and weepy when you have a newborn? Well, the answer is yes and no. A certain amount of exhaustion and being emotional and not having time to feed yourself or being absolutely ravenous is pretty normal when you're literally growing another human, and even for a few weeks after having a baby, because your hormones are all over the place while your body is trying to normalize itself after childbirth, and you're trying to figure out breastfeeding and getting your baby on a schedule, and basically just trying to figure out how to keep a tiny human alive and healthy. But if the symptoms are severe enough to prevent you from functioning properly or they last longer than a few weeks, you are likely suffering from peripartum depression and not just the baby blues, especially if the feelings become severe enough for you to begin thinking of harming yourself or your baby. I mentioned earlier that this is a topic near and dear to my heart, and the reason it hits so close to home for me is because my own mother suffered from severe untreated postpartum depression after the birth of my younger sister. And the unhealthy coping mechanisms that she used in an attempt to deal with it really put a strain on our family, eventually leading to my parents' divorce when I was 4 years old. Additionally, I myself have been dealing with peripartum depression since I was pregnant with my third baby and after her birth 7 months ago. I've been fortunate to have a supportive husband who recognized I was struggling before I was willing to admit it even to myself, and he encouraged me to get treatment, which I've been doing for several months now. I'm so grateful to be going through this now when there's greater awareness, understanding, and resources for peripartum depression, rather than the 30 plus years ago when my mother was suffering through this with minimal resources or even recognition. But while understanding has significantly improved in the past 30 years, there's, of course, always room for more improvement. 15% of women who have given birth experience peripartum depression, and so their children and families are impacted by the condition as well, as my mother's experience with peripartum depression illustrates. Unfortunately, many of these women feel ashamed that they are unable to manage it on their own. I'm here to tell you that needing professional help is not weak. Reaching for the help you need is not weakness. It is time to end the stigma associated with seeking mental health assistance or belittling women for having the baby blues. If you believe you or a mom you love may be experiencing peripartum depression, there is help available. Talk to your doctor about treatment. More information about peripartum depression and links to additional resources are available at www.happyhealthymoms.org. Thanks for listening. You'll see me next time.